Change your camera on.
Yeah.
Alright, so thank you guys for coming this evening. I'm going to be talking about health promotion in nursing. So what if somebody told you that your life expectancy was less than 5 years? Not talking about cancer, nothing like that. Actually, according to the European Heart Journal, for a type 2 diabetic with a blood pressure over 180 and a hemoglobin A1C of greater than 8%, that's what's going to happen. You're going to have a life expectancy of less than 5 years. For type 2 diabetes, increased hemoglobin A1C and high blood pressure in most cases are a modifiable condition. So Corinthians chapter 6 verses 19 through 20 say, "Haven't you yet learned that your body is the home of the Holy Spirit God gave you? Your own body does not belong to you, for God has bought you with a great price. So use every part of your body to give glory back to God because He owns it." I'm a registered nurse. I've been a nurse since 2007. Throughout the course of my career, I've encountered thousands of patients and had multiple opportunities during hospitalizations, outpatient settings, to discuss with them ways that they can be healthier, changes in lifestyle, things that they can do to help prolong their lives and give them a better quality of life. Nurses have the opportunity to promote healthy lifestyles to their patient populations by incorporating the Lord's teaching from the Bible. I plan to discuss with you today various ways that nurses can promote healthy lifestyles in patients, focusing specifically on childhood obesity, type 2 diabetes, and smoking. I'm going to start by discussing childhood obesity with you. So this is a photo from Forbes.com, and unfortunately this is an increasing trend. As you can see here, both of these children are obese and are going to face a lifetime of issues with increased risk of cancer, type 2 diabetes, high blood pressure. There's a lot of comorbidities that come along with this. And in most cases, I mean, these kids didn't go prepare their own meals. They didn't feed themselves. So childhood obesity is defined as a body mass index in a child of greater than or equal to the 95th percentile. This here is a graph from the American Academy of Pediatrics that shows trends in obesity among children starting here in 1963 and going to 2008. As you can see, trends are on the increase. The chart here, there's different lines represented for 2 to 5 year olds, 6 to 11, and 12 to 19 year olds, but all are on the increase. So according to the American Academy of Pediatrics, by the age of 5 years old, a child should have been to at least 14 well visits at the doctor. That gives nurses and physicians and anyone in the doctor office setting lots of opportunities to interact with parents about prevention of kids that you see like that in the picture. There's lots of time and interactions that you can have with the patients and their parents to discuss a healthy diet, recommended levels of activity, which for a child, the CDC recommends at least 60 minutes or more of physical activity per day. And according to the CDC, and as you can see in that chart there, the rates of childhood obesity has more than doubled in children and quadrupled in adolescents in the last 30 years. So clearly it's an issue that is increasing, and it's something where there can be a significant amount of education for patients and their families to help bring this level down. And like I was telling you earlier, childhood obesity greatly increases the risk of type 2 diabetes in patients. So not only are they having issues as a child, but this is continuing on with them for the rest of their lives. Type 2 diabetes is when individual's body becomes resistant to insulin, and obesity is the #1 cause of type 2 diabetes in patients. According to the CDC, from 1980 to 2011, the number of Americans with diagnosed diabetes has more than tripled, and here's a graph representing that. So again, as you can see, diabetes is on the increase. There's also a chart here that shows the age-adjusted hospital discharge rates for diabetes as a diagnosis in a patient. So all of these hospitalizations with diabetes as a diagnosis, an opportunity during each one of those hospitalizations for those patients for nursing to discuss with these patients ways to live a healthy lifestyle, to get active, to eat a better diet, and to help even, they can even get rid of their type 2 diabetes or make themselves less symptomatic, require less medications by changing their lifestyle. To lose weight, the recommendations are for an individual with type 2 diabetes to decrease their caloric intake by 500 to 1,000 calories per day. The recommended diet is high in fruits and vegetables, whole grain, lean meat, low in saturated fat, trans fat, sodium, cholesterol, and added sugar. So there are lots of education opportunities with patients that you can discuss with them, ways to modify their diet, different things that they can eat to help improve their blood sugars and therefore make them healthier. For an adult, the recommended activity is from the CDC is at least 2 hours and 30 minutes of moderate intensity aerobic activity per week, and then muscle strengthening activities on at least 2 or more days per week, and that's for an adult. So another modifiable lifestyle change that does not honor our bodies in the way that the Lord has taught us is smoking. This is 100% by choice. You can't blame any kind of underlying diagnosis, or you're talking about high blood pressure. There's not a family history issue. Smoking is your choice. It's something that you're going to do and choose to do. According to the CDC, tobacco use is the leading cause of preventable death in the United States, and approximately half of smokers are going to die from a smoking-related disease. This is an area where I think that that health promotion and nursing education is actually being successful. Actually, as you can see here, trends in smoking are on the decline. So it's reassuring that what we're doing is working. The dark line here is students, and then the lighter line here is adults. So as you can see, from 1965 until 2011, the rates are on the decrease, and this is from the CDC. I think, and also a cause of the decrease in smoking is the increased tax law that they're charging for cigarettes nowadays. So if you break it down, smoking 1 pack per day in the course of 1 whole year is going to amount to over $5,000 spent on cigarettes. If you multiply that times 20 years, which is less than some people smoke over the course of their lifetime, it's over $100,000. I mean, if you could apply that to a house, it's incredible. If you look at this illustration here, this is from the University of California, San Francisco. This is a smoker's lungs compared to a non-smoker's lungs, and pretty evident the difference. Nursing has a lot of opportunities to provide support groups. There are alternative therapies, hypnotherapy, acupuncture in terms of stopping smoking. There are also a lot of methods in terms of patches, over-the-counter gums, things like that, as well as prescription therapy. So there's many options available for smokers that may have started smoking back in the 60s when we didn't know all the side effects that were there, that are addicted now, that have options available in terms of quitting. So, in summary, it's up to the individual to choose whether or not they want to participate in their own health promotion. It's a choice. I can educate you as much as I want, but it's ultimately up to you. It's a nurse's job to promote healthy lifestyles and to encourage their patients to honor the Lord by taking care of their bodies that the Lord has so graciously loaned to us. I've discussed with you several different ways in which nurses can help influence patients to make good choices regarding their health, and have listed several different preventable causes for declining health in the U.S. today. As you leave, I hope that you'll make the decision to take an active role in your own health promotion and honor the Lord by living a healthy lifestyle. Thank you all for coming. Have a good evening.